Mr. Speaker, will you please call the House to order?
The bill is passed.
We'd like to get a budget that represents the interests of the people who are standing here with me now.
To be part of the struggle to achieve a better society for all.
We did discuss this in the Health Committee. Welcome. I'm Amy Paulin, Assembly Member for the 88th Assembly District, and this is my show, Assembly Update, and I'm very fortunate today to have two guests on my show who are visiting Albany, and they're here to talk about what they do. And we have Stephen Ferrara, who is all the way to my left, and he is the Executive Director of the Nurse Practitioners Association, and also a teacher of nurse practitioners, right? At Columbia.
At Columbia, yep.
And we have Kamilah, I didn't want to say your name wrong, Dowling, who is my constituent, a resident of Scarsdale. And she's right now going for her doctorate degree, very impressive, in nurse practitioner. To be, well, I guess you are a nurse practitioner, yes. But to further your education, actually get your doctorate at the school that you're teaching in,
That's
right?
Correct. That's
so,
correct.
So welcome.
Thank you.
And I thought, you know, when I first, you know, most people, you know, luckily, you know, are not as engaged in their health as I don't mean in their health, but in the healthcare system,
sure.
as you are, obviously. And so when you go to the hospital, you know, you have your physician. You don't really know even what a physician assistant is, more or less a nurse practitioner, and the differences between that and nurse. And there are such clear differences, not only in the law, but in what you do every day.
Correct.
So I thought, you know, maybe you could spend a few minutes educating us. You know, what is a nurse practitioner? You know, what is a nurse practitioner compared to a nurse? You know, educational levels.
Sure.
And you know what you do, you know, every day in the healthcare system.
Okay. Nurse practitioners are first registered nurses trained at an advanced level. They're prepared at the master's and doctoral level, so they have advanced training and education. Nurse practitioners can treat, prescribe, and also have ownership over their patients. We practice in the primary care and specialty settings as nurse practitioners. Physician assistants, the difference I would say is nurse practitioners can practice independently. We're our own autonomous providers, whereas physician assistants require a physician. They're tied to a physician at all times. They cannot practice independently.
And how many years of schooling is you know, do you have to go through initially to become an initial nurse practitioner, and then, you know, to go on for your advanced degrees?
So there's the foundation as a registered nurse, which is 4 years to get your bachelor's degree. Then there's an additional 2 to 3 years, depending on your specialty, to obtain your master's. And there's several specialties in the nurse practitioner role, whether it's pediatrics, adults, gerontology.
So similar to a physician doing their internship in their specialty, right?
Correct.
You have one as well.
Correct. Yeah. We have the specialties that are, like Kamilah mentioned, family practice, adult, women's health. So we're in all areas of the healthcare spectrum. And there are the doctoral level that is not mandatory, but many nurse practitioners are opting to get this terminal degree today because practice has changed. We're looking for evidence-based practice. We're looking to use the best data. We're looking to be culturally competent in the care that we give. And a lot of care has become more about transitions and coordinating care. It used to be in the good old days when you were able to go to your provider's office, you know, they did everything there. But the system is very complex today. We're talking about electronic medical records and the economics of healthcare. It's very vast. And part of this education is allowing the nurse practitioner to really become immersed in this new world, this new system.
So, you know, if someone goes into a retail clinic, we're seeing them emerge all over,
Sure.
right? That's who you would come across, right? A nurse practitioner with those kinds of credentials, because otherwise a nurse couldn't operate without much more, with direct supervision.
Right. So in New York State, and every state is different, has their own laws. New York State, prior to 2015, a nurse practitioner had to have a written collaborative agreement with a physician. And that agreement without that agreement, the nurse practitioner had no practice. It sort of outlined what the NP could do, how often their charts needed to be reviewed, which protocols they're using. We were very fortunate in the last budget session because the trend is to move away towards that, because what has happened